today, and we're at our Raleigh office, which is at 8300 Falls of Noose Road, Suite 112. We're out right across from Lafayette Village and next to Piper's Tavern, out by where Falls of Noose Road meets 540. So for those of you who were trying to maybe get a mental frame of reference for where we are in our Raleigh location, that's where it is. That's where we're broadcasting live from today. And we're actually in the front part of the office in the little marketplace that we have that sells protein products. And we're near the front door, and you may actually hear people coming in and out and the beep of the door and stuff. So I'm just kind of giving you a heads up that may be the case. I'm here today with Michelle Kennedy. She is a nurse practitioner who works here in the Raleigh office, and she is an outstanding, seasoned, experienced obesity medicine specialist. And so we've done one of these together before, and she is a wealth of knowledge. So I'm glad she's here with me today to do this. Thank you for attending this event. And we've got some questions already that have been coming in. So the first one has to do with looking at our website. We have some information on there, some verbiage about a metabolic assessment that we do here in our office when you're a new patient, for example. And the April wants to know what is it and how does it work? And I would say thank you, April, for asking this question. And we would like to answer this. I've been wanting to answer this. I'm glad someone actually asked it. So Michelle, when you hear that, kind of describe how you do the metabolic assessment.
So the metabolic assessment begins with the providers going through paperwork that you fill out as a new patient, indicating what medications you're taking, what medical conditions you have, your weight history, your diet history, things of that nature. And the most important part of that is your previous medical conditions or current medical conditions and the medications that you're currently on, because we know that there are a lot of medications that are considered weight positive or can make it harder to lose weight and easier to gain weight. And so we need to make sure that if possible, we can decrease the number of medications that you're on that could be making it more barrier to lose weight, and then provide you with medications to help you lose weight. So that's a big part. And then we also, every new patient does a full body composition analysis. We have a scale that through the bottoms of your feet, barefooted, will do lean body mass, we'll do body water percentage, body fat mass, calculate your metabolic rate as well as your BMI. So that's part of the metabolic assessment as well.
Yeah, that's right. There's a lot of common medications that patients are on when they come see us. We call those concomitant medications. In other words, you would be taking medication for some other condition. And unfortunately, some of these medications can be a very powerful signal to hold on to weight or to gain weight. Just some common examples of that would be Prozac or Paxil, for example. Those are common antidepressants that are used and really make you pack on weight. Prednisone is another really good example of that. And I mean, there's lots of examples. So you'd be surprised. Some of the things that you might be taking if you're a new patient actually could be part of the reason that you're gaining weight and not losing weight. And so we want to identify those things and let you know, okay, here this could be a problem, and here's how it can be fixed, and here's some different medications you could take in the place of those. Now, we don't usually make those decisions independent of your primary care provider. We like their input on that sort of thing, if there's going to be any sort of medication switch, but just making both the patient and their primary care provider aware of that can be very helpful, because it often leads to change to medications that are what we call weight neutral, which will actually not get in the way of you losing weight. The other thing I would say is we have a pretty detailed, if patients will take the time to fill it out, and most of them do, but a nutritional assessment is part of your new patient paperwork. And I think Michelle would agree with me that a high insulin level is a very powerful chemical stimulus that makes you gain weight. And on that nutritional assessment, if you filled it out, we can identify things in your eating pattern that are going to raise your insulin level. And but just think high insulin level, low metabolism, fat storage mode. So in addition to these medications, in addition to getting an assessment of your body fat percentage, for example, your body composition, also identifying what foods are sabotaging you by raising your insulin level. It's part of all of that metabolic assessment. So I think that's an important thing. Most physicians aren't trained to think this way. So we really are on the ball with this stuff in both our offices, and I think it's an important part of your initial assessment. Thank you, Jessica, and others for joining in today. We really appreciate you paying attention. Let's and giving us your time. Feel free to send in more questions. We like those. I got another question here, and this was from somebody who was a patient some time back, and they haven't kept up with it, and they want to know what it takes to get started again. This is a very practical question. What do you think, Michelle?
Question we get a lot. Do I have to be a new patient again? How long before I can come back? And we say, you are always welcome. Once you have established as a new patient, you are always then an established patient. It does not matter if a decade has passed. Now that we have been open long enough for that to happen, we will still welcome you back. We will have you do a little bit more paperwork, just kind of a front and back to update us on what's changed, what's happened since we saw you. But it does not cost any more to come back as a restart than it does as a regular follow-up patient.
That's right.
And that's a very important point.
Yeah.
And we do our best to just get updates on what's been going on and help you where you're at. If things have changed and you need a new plan, or you don't remember it working out as well as you thought it did, or it worked great and you just want to get right back on, either way, we are here. You can come back in. And that just requires a phone call to either our Raleigh office or our Durham office, whichever one you'd like to make an appointment in. And we can set up an appointment. We're pretty open this week. I know in both offices we have some holes in our schedule, so don't hesitate. Now is the time. It's always now is the time.
That's right. I've been experiencing the phenomena of people getting restarted in the last couple of weeks during the middle of this COVID-19 outbreak. We remain an essential business. We're open. Obesity is killing in this country 325,000 people a year. That's almost 1,000 people a day, and it's been an epidemic a long time. And so we're here to treat that, and this is an essential thing. So we can either do this by you coming into the office or by a telephone follow-up if you need to isolate yourself. And that's fine. I don't want to drop the service either way, because this problem goes on. And from a personal philosophy, I don't want to charge people a bunch of money, again, like a new start, if they hadn't come for a while. I don't want to put up barriers to them getting restarted, because this is a serious disease that we treat here. And we want people to have access to it at the lowest prices that are feasible. And we want to make it easy for you to come back in. We have an on-site pharmacy. We can, when you come to see us as a restart, for example, during the middle of this crisis, we can give you your medicine right here. Mm-hmm. So that way you don't have to go to a bigger pharmacy where you might be exposed to a lot more people who could potentially be sick. For those of you who do telephone follow-ups during this time, we can ship the medication daily from our pharmacy to you, so you don't have to go out anywhere to get it. And that's kind of, normally I wouldn't have to say that, but we're in the middle of kind of a pandemic crisis here where we're having to watch our P's and Q's pretty close. So we're providing you access to the office and access to follow up by telephone. And in most cases, we got the medication part of that covered for you. And we're not going to make you pay any kind of new start fee or jump through a bunch of hoops to get restarted. The worst hoop is, just like Michelle said, filling out some extra paperwork, right? That's about the worst part of it. And I have to admit, it's kind of a humorous point. I always say, the way to break any person psychologically is to make them fill out enough paperwork, and eventually it kills them. So I apologize ahead of time if you find the paperwork laborious.
The restart paperwork is really not that bad. It's literally like one page front and back and then a signature on the second page. It's not bad, I promise. So moving on to our next question. Claudia is asking that she's seen in our emails advertisements for the lipotropic injections, also on our website information. What exactly is a lipotropic injection? What are the benefits? How does the Fat Burn Plus work? That's one of the two we do most often. And how often should I come back to get these injections? So thank you, Claudia. That's a very good set of questions. I know you've done a lot of videos, especially when we first rolled these out, that are available on our YouTube channel, as well as you can get to it through our website.
That's correct.
That explains what these are, what the benefits are. I know I have probably given thousands of these injections, considering I'm the main one in the Raleigh office here on Falls and Noose, giving them. And patients really do love them. I mean, I know, Dr. Simonds, I'll let you get into the science, why he brought them into our practice. But I can say, from a clinical standpoint, day-to-day care with patients, they report they have more energy, their mood is better, their sleep is better. They find it easier to control their appetite, control their cravings, just stay on track. So these injections, which is what I describe as a slew of B vitamins and amino acids in injectable form that we only give in the office. We cannot ship them to you. We give them here in the office, administer them to you either in the arms or the hip if the arms are sore. But they really do have a positive response. Would you agree?
I do agree. I think there's a few points about all this. The first I'll say is that, when you talk about something like this, the way things work in our country, you're seeing a little bit of this with the crisis, is that we kind of have this standard now of studying things from an FDA standpoint. And the amount of work that it takes to conduct a prospective trial to validate what things do, it's almost insurmountable unless you have a ton of money and organization to do it, right? So drug companies, for example, can afford this and they get some profit from it. But there's a lot of things like supplements that, are out there that it's just there's never going to be a trial for practical reasons. And they may really help people. And so this is something that's been very popular with patients in obesity medicine programs for a long time, and even outside of obesity medicine programs, okay? So I want to clear up that they're not FDA approved for any particular reason, just like taking vitamins over the counter aren't FDA approved for any reason. That being said, they can be very helpful to people. And Michelle hit on some really good points. We give a lot of these in our office, and I always say people don't buy what doesn't work. Okay, and so they'll come back and tell you again and again and again. And this has been my experience because I've taken them 40 weeks in a row. These injections really make people feel better, have more energy, sleep better, better mood. She mentioned cravings. All of these things are things I hear every single day from patients in the office. Now, I suggest that you do them once a week. I feel I can tell the difference every week when it gets toward the end of the 7-day period, and then I get them again. And I really like the way they make me feel. I think that the way that they probably help you lose weight is twofold. When you're bothering to come by my office and get an injection in the arm, you're probably going to be a serious dieter. Okay, and so that's probably why you'll see people who do it lose more weight. The second would be that if you feel better and you sleep better, you're much more likely to be active and to do things that would cause you to lose weight. So I want to be careful not to suggest it's a magic bullet because I don't think it is, but I think as an overall part of a supplement to your weight loss regimen, I think it could be something that can be really helpful to you. And it's worth trying if you haven't. You'll know when you try it. You'll know how it makes you feel. And it's the prices. We have good prices on that if you've ever compared it to other places. And anyway, it's something that's available to you. We will never twist your arm about it, but we have a lot of patients who take advantage of this and get them every week and really like them.
Yeah. And you don't have to get them every week. So if your schedule is that you're worried, well, should I not get them at all if I can't come in every week? The answer is no, you should definitely still try them. And usually within 24 hours, you feel it. A lot of people, if I give them an injection like mid-morning, they'll come back and say, that night I slept so much better.
Yeah, that's right.
So this is not an effect you have to wait for. This is very immediate. And I know that Claudia had asked too, what's the difference? I will say the Fat Burn Plus injection has vitamin B12 in it.
Yes.
And that's a specific one that we've been doing for a long time before we introduced the lipotropic injections. And the B12 is one of the more important ones when it comes to sleep and stress and mood. So that one is a little bit different than, say, the Super B, which has more of the other B vitamins that are more energizing,
That's right.
but not the B12. So a lot of our patients actually get them in combination. I'll give them one in each arm. And I will say, even patients who do not like getting injections will endure the very brief little prick. It's really not that painful in order to keep coming back. And that tells me, not only are they taking time out of their busy schedule to come in, but they're enduring something they wouldn't really choose to unless it was absolutely worth it.
Yeah, that's right. So let me just take a moment again to remind people who may be joining in, and I want to welcome you. This is a Facebook Live Ask Me Anything event for Dr. Simonds Metabolics and Weight Loss. We're at our Raleigh office location, at our Falls of Neuse location, which is right across the street from Lafayette Village and next to Piper's Tavern, out by where Falls of Neuse meets 540. We're in the front part of the office here in the protein marketplace, and you may actually hear some people coming in and out of the door. Don't be alarmed if you hear that. That's normal. I want to make one more point about that. The Fat Burn Plus and the form of the B12 in there. So the form of the B12 is compounded by a pharmacist to be what's called methylcobalamin. And the standard vitamin B12 shot is cyanocobalamin, and you have to convert it to the methylcobalamin to be for it to be effective. And we now know in medicine there's a lot of people who can't make that conversion very well. So you may have tried a standard B12 shot and felt like it did not help you. This methylcobalamin is the real deal, because there's no conversion that has to take place, and it absorbs directly. And it really, really makes a difference for a lot of people.
Yeah, Jessica even chatted and told us they work really well for her mood and energy. So we're so glad it's helping you, Jessica.
Yeah, that's right. Thanks for that comment.
Yes,
and I mean, if you sat in my shoes all day long, you would hear this stuff. So if you haven't tried these, this is a good time to try them. You'll know if it doesn't seem to help you, well, that's fine. You don't have to continue to do them.
And you do not need an appointment to get them.
That's correct. You come in anytime we're open.
Yeah, you don't even need to be a current patient that's coming every month. If you aren't quite ready to restart on medication, but you'd like to try the injections, just come in. You do not need an appointment. We're not going to pressure you into anything else. It's a very quick in and out. So you're not going to be lingering or waiting very long. So we can really make it quick.
And so anyway, we have in that regard, we do have pretty convenient office hours, and which include express hours on Raleigh 7 a.m. to 9 a.m. and in Durham on Thursdays, and in Durham 7 a.m. to 9 a.m. on Fridays. And a lot of people will come by before they go to work during those express hours to get those injections. So we try to make it convenient so that, like Michelle says, it's a quick in and quick out. You can do it on your way to work or on your way home from work if you're a night shift worker, for example.
Okay. We're going to go ahead and jump to a question from, I'm not sure who it's from, but it's a very good question. It's, what is the best diet and medication approach after cancer treatments? Including surgery for breast cancer. Oh, it was Martha. Thank you so much, Martha. Surgery for breast cancer, which is estrogen driven, and the radiation is completed. So that is a good question. I will say we have a good number of female patients in our practice who have gone through breast cancer, as well as patients who have endured other types of cancers and have been able to go into remission and still need help with their weight. Oh, it wasn't Martha, it was Val. Sorry about that.
Thank you, Val, for your question. Martha, we gave you credit, but it really was Val.
There may be Martha somewhere.
That's right. Okay, our bad on that one.
Okay.
Yeah.
So what would you say?
Yeah. So I kind of like to talk about this because I happen to, well, it's going beyond just, me theorizing about it. It's really becoming more clear that many types of cancer, the growth can be driven by, the ingestion of things like sugar. So the growth of the cancer heavily depends on a glucose insulin mechanism. And when you ingest things that raise your blood sugar and get the surge of insulin, this actually drives the growth of the cancer. So when you look at those cancer cells on the cell membranes, you'll find this out. Now, some other exciting news that over the last 10 years has become scientifically available is that there are properties of ketones. And so ketones are what you generate when you burn fat. You burn fat, let's say you're on an Atkins style or a really low carbohydrate diet, you'll start burning fat and generating ketones. And one of those three ketones that's generated is called beta hydroxybutyrate. We call it BHB for short, and because that's a long word. But we know that this particular ketone has an inhibitory effect on many types of cancers. So this is this is why ketogenic diets are becoming popular, if you will, or more common in the field of oncology. And so Michelle and I have we have the privilege of being able to attend obesity meetings that might run 4 or 5 days long and have continuing medical education. And frequently now, one of the topics that's addressed in lectures by oncologists is this very topic, the idea of a low-carb ketogenic diet in patients with various types of cancer. And so I'm excited about this. So when I see anybody who is a cancer survivor, or I see some patients who are still undergoing treatment now, and this is the kind of diet I recommend to them. And I really hammer home the point. The thing that you really want to stay away from, number one, is sugar. And then number two is refined grains. And I think that's really, really important. I would think, well, I tell you what, sugar and, in the form of things like high fructose corn syrup, I think down the road, 25 years from now, we'll look back at that and say the same thing that, we say about cigarettes now, right? I mean, it's going to be like, hey, that stuff doesn't belong in food. It's a toxic thing that hurts people. So anyway, that would be my comment on that.
And Martha, I know you haven't, like you said, you haven't been in a few weeks, or you haven't gotten the injections in a few weeks, and you're really feeling the effects of not taking them. Come on in.
Yeah,
let us help you with that.
That's right.
You can wear them if you're uncomfortable. You can wear a mask.
That's right.
We don't bring you way into the back. There's not a lot of other patients in our waiting room. And if you don't feel comfortable, that's okay. But if you want to come back, we are here. And Bob, we're really glad you came back.
Now, none of our staff we're not letting them come to work if they have any symptoms at all. We're going out of our way to sanitize everything in the office. Even the pens that you sign with get sanitized. And so this is probably a good time to start wearing a face covering if you're going out. And we'd love for you to come back if I can't do your injections if you're isolated at home. So this is a safe environment. We don't want you coming to the office, by the way, if you're feeling sick. We ask that you stay home. And but I think pretty much our patient population is at that point, right? Mm-hmm. They're not coming.
Mm-hmm. I'm going to touch really quick back on Val's question. She asked about diet and medication. And I'll just say, if you have had a history of a medical condition like cancer or many others, that often does not prevent you from being able to take medication for your weight. And that is why you meet with a medical provider, so we can talk about your options, because often you still do have a lot of options.
Yeah, that's right. So I can sit here and tell you, Val, to say, oh, okay, let's go on a ketogenic diet. And that sounds really good. It's harder to do when you're hungry and craving things all the time. And the medication we can recommend and prescribe to you here and send you home with will help control those things so that you're able to do that kind of diet. And they're completely safe to take in patients who've had a history of cancer. So that's the good news about that.
All right. So we're going to touch a little bit, because we're set up in this area, the protein marketplace in Raleigh, which is on Falls of News Road, across from Lafayette Village, next to Piper's Tavern. Pretty easy to get to. We're a little hidden back here, but if you know where Piper's Tavern is, you know where Lafayette Village is, you can find us. And Durham has a similar setup, actually even larger, because our Durham location does see more patients on a regular basis than Raleigh. But as you can see, we still have a lot here. We have sweet, we have crunchy, we have salty, we have chewy. I mean, we kind of cover the flavors, we cover the textures, and then we also have, you'll see here, Metagenics, which is a very high quality pharmaceutical grade supplement company. And we carry a multivitamin, a fish oil, vitamin D, things that we're recommending on a regular basis to our patients. What would you say your favorite thing is in this marketplace?
Well, there's a couple things. You pointed out that there's different textures, and then, salty versus sweet type stuff, and crunchy, right? So I'd say this is stuff that our patients asked us to carry, so they liked it anyway. One of my favorites on the sweet is we carry a line of bars called Adapt, and these things are fantastic. The stevia is the sweetener in there, and we know the owners of the company, and those bars, if you've not tried them and you want something sweet, they meet the nutritional profile you're looking for, and they really taste great. Now, if you're looking for something salty and crunchy, I really like the Quest chips, and so we've got. For example, for those of you who, I'm not saying anyone has, but for those of you who may have had a problem with Doritos in the past, me being one of them, these things are fantastic, and they really do taste great. And we sell a lot of those. Once you taste them, you're like, man, I didn't realize I could get something that's low in carbs and high in protein that tasted that good. And then look, we carried these ostrich sticks. In various flavors, and we sell a lot of those. So if you like, if you like a beef stick that actually is pretty healthy, right? Mm-hmm. That's definitely the way to go. And so I love those things. I love all three of those things, and I don't know. I guess it just depends on what mood I'm in, but that's kind of my go-tos.
Mm-hmm. All good choices.
Yeah, so Martha, I understand you miss.
You miss her humor.
Yeah, I do. I do. And I'm a pretty down-to-earth guy who likes laughing and cutting up a little bit with my patients. And Martha, I do miss your humor. And so thanks. And look, thanks for tuning in. So and saying hello. We miss you here at the office. We like hearing from everybody. And I'm real happy. I mean, our patients stay engaged, man. It's kind of like a family type thing, and that's right. So we really hope everyone's doing well during this time. We want to encourage everybody. We're going to get through this thing. So and then look, Michelle, you made a good point about these Metagenic supplements back here. They're really great. If you need some vitamins, the vitamin D, the fish oil, this probiotic, this is a time to come out and get them. Again, this is a safe environment to come pick them up at. And so even my 81-year-old father comes by to pick them up in the middle of the crisis. So he feels pretty safe coming here. Anyway, I think we got one more question. We got two, really. We have time. Mr. Producer, we have time for two questions. Okay, so the first one is from Jackie, and she's talking about the fact she's having trouble sticking to her diet. And as a result, she's gaining weight. She says she's experiencing a lack of motivation and a mental block. How do you get back on track? Well, that's a good question. So a part of it, I always say, if you're not taking medication, it's a biology. The way your mind signals your body, hey, that I want to eat, I crave things. This is a biology that medications help with. So if you hadn't been to the office a while, you don't have any medication, this is the time to get going again, because medication is going to help take you out of that thinking I need to do something different to actually being able to do it, because you can control your hunger and you can control your cravings. So the other thing I would say, there's some real practical things to getting motivated and staying on track. The first is make a plan. And I'm telling you, making a plan doesn't take longer than a minute. Jot it down on a note card. This is what I'm going to do tomorrow. Okay. And what you'll find is, from a psychological standpoint, people who go through that small mental exercise, 80% of the time follow through with their plan. So the first thing to do is, hey, just say, okay, I know where I'm at. I'm in the camp of the enemy over here, for lack of a better way to say it, and I need to get out of this camp. I got to break through the gate and start doing what's right. I think I'm going to have this for breakfast, this for lunch, this for dinner tomorrow. Okay, now you're starting to get a plan. Write that thing down. When you get up, in the morning, stick to your plan. Say out loud you're going to stick to your plan. That'd be my first piece of advice to you. Now, why don't you read this final question?
So Samantha is asking, our thoughts on eating late at night. Does it matter if I haven't reached my calorie limit for the day? And that is a very, very good question that we've gotten before. And actually, Dr. Simonds and I recently did a podcast together for his Casual Keto Doc website. And we talked a lot about circadian rhythm on that. And there really is biologically something very important about trying to eat when the sun is up and not as much when the sun is down. So timing of calories do matter. And even if you haven't reached your calorie limit for the day, especially if you're not hungry, we're not really meant to eat just up to a certain number of calories to fulfill a goal in MyFitnessPal or whatever app you're using. So I would say it is best not to be eating super late at night, unless of course you are a shift worker and you don't really have any other option. You agree?
Be like the lion. The lion doesn't eat when he's not hungry. You're right about that. So yeah, you don't have to just arbitrarily eat to a calorie limit just to do it. That'd be my advice there. Okay, well, we want to thank everybody. We want to remind you that you can find us at simonsmetabolics.com, at thecasualketodoctor.com, or you can follow us and like us on Facebook, which we'd really like. Okay, and look, we've had such a response to these AMA events on Facebook that we're going to continue to do those. So pay attention to your email announcements and our Facebook page. We'll announce these sorts of things, and we want you to be involved in that and continue to have an open channel of communication with our patients through Facebook here. So thanks so much for participating. We're grateful that everyone's paying attention.
Yes, thank you. Stay safe and get some fresh air. And we're going to post notes and this video online. So if you want someone who hasn't been able to attend live to see it, go ahead and share it with them, and it will be there.
That's right. Okay, that's a wrap.
Thanks, guys.